Hi, this is Dr. Alicia Johnson. I wanted to give you a quick video to explain how our new patient visits work. So if you could watch this before you book, that would be great. The price of the visit is $450. It is not covered by insurance, but you are able to submit the paperwork to your insurance company as an out-of-network provider. You can check your out-of-network provider benefits through your plan. We do accept flex spending or healthcare savings accounts. If for some reason your card won't swipe with us, we'll give you the paperwork you need to make it work. So normally we take credit card, and we do require that you have a credit card on file to reserve your spot. We do suggest that you have about 2 to 3 hours to set aside for your first visit, depending on the amount of examinations, blood draws, those types of things that we need to do. We do request that you arrive fasting so we can get a fasting blood draw. We will feed you, and then we will draw your blood again after you've eaten. We're going to be collecting things like saliva and urine, so we'd really like it if you come in without even having any coffee or anything, just water is fine. Fasting just means not having eaten from the night before. You can take any required medications before you come. If you're on any hormones, then I want you to take the hormones exactly 6 hours before you arrive. Not the night before, not the hour before, but exactly 6 hours if that's at all possible. Thyroid medications, just take them as normal. If you have not submitted your paperwork before your visit, which we really prefer you do it online so you have time to look at it. If you have not submitted your paperwork, you need to show up 15 to 20 minutes before, because we only have that amount of time set aside for your appointment. And if you spend a lot of time filling out that paperwork at the front end, then you'll have less time to focus on your care. So please try to do that. You'll get it through your portal. We'll remind you to. So if you can, throw all your supplements in a bag, throw all your meds in the bag. I like to physically look at them. I like to make sure that the doses are accurate, that I know what ingredients are in your products and all of that stuff. So if you can, throw it in a bag. That's great. A detailed list too is fine. A bag is better. The labs that we start with are submitted to insurance, and the coverage generally is very good. We use the lowest cost labs we can possibly find, and the labs that we do, because we do not mark anything up in our lab, anything that we order is the lowest price you can get. So whatever insurance covers is great. For most people, there's little to none left over for the first round of labs. Now, sometimes we do specialty labs, but we don't typically start there. So that means you can expect that your labs will either be totally covered or mostly covered. We do have a fairly strict cancellation policy because our appointments are really long, and so we're here for you, and we have people waiting for appointments. So we need 48 hours to cancel an appointment. Missed appointments are charged at the full rate of the appointment. If you forget and you don't show up, we'll call you and switch you to a phone appointment. But we do hold you to that appointment time because we have a team here waiting to help you for an extended period of time. The office is close to Oak Park Mall, so it's just west of Oak Park Mall on 95th Street, kind of right next to the train tracks. Obviously, you could use Google Maps, but just to give you an idea of where we're located, it's not too hard to find. We're in a little strip mall. Parking's easy, so you don't need to worry about that. So just so you know kind of what to expect, I'm going to spend a lot of time asking you a lot of questions about when did your health problems start, what's wrong, what's bothering you. If you have a headache, how many days a week do you have a headache? How long does it last? How bad does it hurt? I'm going to ask you a bunch of questions. So that's what a lot of the time is spent on in the first visit. I want to understand everything. Then I will go over records if you bring them. Now, I don't always have time to go over an entire large medical record in the amount of time that we have allocated, but I always like to go through old labs. Paper labs are great. When you submit a PDF, it takes a doctor a really long time to scroll through that, so sometimes they skim. If you have paper copies of your labs, you will always be more effective at getting the doctor to actually flip through and see them all, including me. If my computer is running really slowly trying to read a 300-page document, we might not be able to get to all your stuff. So just as a general rule with me or anyone else, if you have lab records, try to bring them on paper. We'll go through all of that stuff, and then at the first visit, we're gonna make a partial plan. We'll decide what we wanna do. It may involve diet, exercise, herbs, any suggestions in what you could do differently with medications, lifestyle, just all kinds of things for how you can help start to heal yourself. That will be based upon just my intake and understanding of you. Once I know more about you, labs will come back after a week. Once I know more about you, typically we follow up that week later to refine your program based upon the diagnostics that we have. Now, in some cases, we could wait 5 weeks, 10 weeks, even 3 months before we need to follow up. But it's reasonable to assume that if you need an extensive amount of labs, that we're going to follow up a week later to go over them and update your plan. So those are kind of the main things that you need to know about our office. Also, we have an emotional support dog that will greet you at the door. If you do have a problem with animals, a problem with dogs, would you let us know ahead of time so that she can stay at home? She's over here in the office just having a nap. She's pretty easy to be around. So, but do let us know if she needs to stay home for the day. And if you have further questions, you can book a free 15-minute consult with me online to decide if care with me is the right option. You can also call the main line, 913-888-0331. You can email at Dr. Johnson, Dr. Johnson at AspireHealthKC.com and ask more specific questions. But the best thing to do if you have questions that are more clinical is to talk to me. If you have questions that are more procedural, you can reach out to the office. Email is ideal. Our phone person is often on the phone answering questions with other people. So email's great. If you're not a technology person, feel free to call and she will call you right back.